All right. Thank you, everyone, for joining us for another installation of A4LI's podcast series. I am being joined by the prestigious, the very well-known Eric Verdin from the Buck Institute. The CEO of the Buck Institute is with us today, Eric Verdin. Eric, can you say hi to our A4LI audience?
Yes, good morning, Dylan. Thanks for having me, and good morning or good afternoon to your audience wherever you are.
I
Delighted to be here.
You're a Pacific guy. I'm an Eastern guy. It seems that the community we need some more Mountain Time and Central Time longevity people. I don't know where they are, but it seems that they're either on East or West. So, yeah, for me it's afternoon. For you, I guess it's good morning. But thank you, Eric, for joining us. I really appreciate it. So the first question I kind of want to ask you, and this is how I start off pretty much every interview is I like to know what got our guests into this space, because it's such a aging research, right? Is such a niche and specific and unique field to be involved in, right? So Eric, can you kind of give us your backstory, give our audience your backstory? Who were your inspirations? What inspired you to make aging your cause? Yeah, floor is yours.
Yeah, it's fun to reminisce on this because I think many of us go through life not always fully aware of why we're making specific decisions. But there's in terms of my career in science and medicine, there's definitely a few things, that sort of landmark moments that I clearly remember. One of them, which I was 7 years old, I was invited to a birthday party, and my friend got a microscope and crystals to look at. And I still remember, I mean, to this day, the feeling of awe that I had by sort of looking at reality in a different way, just looking at these simple, copper crystals and so on under a microscope and discovering something that was so beautiful and different. And that really was one marking event for me. And from that moment, I had this feeling, I'm going to be a scientist. I want to do something related to science. And another event that happened in my youth was the lunar landing. And I remember being on vacation and watching this on television, on a small television in a camping ground with my parents, and just feeling this is just awesome. And, really envisioning all of the future of humanity, both in terms of space travel and just the technological potential. So those two just really drew me to a career in science, which was initially focused on astrophysics, and I wanted to be a physicist. But eventually, on the advice of a family friend, told me, the next century is going to be, when you going to be doing your career is going to be really focused on medicine and biology. And so I decided to go to medical school, and I was sort of an unorthodox medical student because I did research all throughout medical school, and then did a couple of years of clinical training, and then went directly for postdocs with Ron Kahn at Harvard Medical School, where I never came out. I went into the lab, thinking this will be a research experience, and I'll go back to seeing patients and doing research. But I never went back to the clinic. And so I've conducted most of my research career studying epigenetics. My lab back in the mid-90s cloned a family of proteins called HDACs, histone deacetylases, which were some of the first known and identified epigenetic regulators. And this led us to aging, because it turned out that not only the HDACs, but the sirtuins, which are also epigenetic regulators, were involved in the aging process. And so for the last 25 years, I've been basically focusing on the biology of aging. There was another story in my sort of more personal life that made sense, which is the story of my father, who was a wonderful man, a great father, but was a heavy smoker. And I saw him, from age 55 to when he passed away at 77,
Yeah.
having every single complication of aging,
Yep.
of
Yep.
aging and smoking, heart
Right.
attacks, bladder cancer, lung cancer. And this is at that moment that I really became passionate about just making sure this wouldn't happen to me, but also to anybody else, because I saw the suffering and I saw the loss of quality of life, which is unfortunately is the lot of many people in our society right now. So the combination of being a scientist that studies aging and the personal sort of pain of seeing someone you
Yep.
love suffer from the aging process just really has focused me in the last probably 7 to 8 years, really understanding the mechanism that drive the aging process and really pushing an agenda for intervention in humans, so bring all of this science to humans. And these are the two factors that really, if I look at my career right now, what I'm doing, and I'm sure we'll have a chance to go through this later, is really focused on the basic biology of aging and its translation into humans.
Yep. Yeah. Well, my first initial thought to your response there is, usually you hear like Elon Musk talk about, the space, stuff in or Bezos or Branson or whoever the space people talk about, the lunar, the moon landing being their kind of inspiration to get into science and really rocket science, right? But you don't hear many. I've never heard someone in the aging biology field talk about.
It's always a first.
Yeah, right. That's interesting. But yeah, I do agree. I feel like a lot of people have a personal story that pushes them into this field, right? They kind of come from a different background. I too was a physicist. Physicist. I majored in physics in college, and wanted to be an engineer for most of my life. And I think kind of my way of thinking through my physics background has kind of led me to see the aging process as a malleable process that we can potentially intervene in, right? And I think your background probably also led you to that belief as well, right? So I'm glad that we have you leading the charge, but I'm also glad we have you as you're an outside the box thinker, and I didn't even realize that. I didn't realize you were a physicist before this, but that's fascinating.
I was passionate by physics, and
right.
I would not call myself a physicist.
Right. I mean, I majored in physics, and I won't even call myself a physicist. Yeah, it's hard to call yourself a physicist, but yes, the physics background definitely kind of gives you a different kind of viewpoint of this whole biology field. So that's fascinating. That's a great backstory. I'm glad that you just told me and our audience it. And it is good to kind of look back. I have a shorter kind of window to look back at because I've only been doing this for a few years. But it's always nice to kind of look back and see what got you on the path that you are now, right? So I'm glad we could rehash that. All right, Eric. Let's get into the meat and potatoes here. Let's talk about what you're up to right now at the Buck. What are you up to? You're really focused on understanding the process of aging, right? That's the Buck's main focus. Why? What's the importance of that? Why is it going to change the world? Can you kind of talk about what the Buck's main focuses are and how they'll be super impactful in the longevity and aging field?
Yeah. Yes. So I wear 4 different hats, and maybe yes. I'll just go through them as a group. The first one is as the Buck president and CEO, I represent the Buck and lead it. And just a word of introduction for your audience who might not know about us. We are a 300 people research institute. We're not for profit. We have 20 faculty members. We study all aspects of aging. The premise of our work is that no one really knows which of the manifestations of aging is going to be key in terms of interventions, in terms of bringing this to humans. But and so we have groups working on mitochondria. We have groups working on stem cell. We have groups working on senescence. some on Alzheimer's disease, on basic metabolism, and so on. So just take the 9 hallmarks of aging, and we have programs going in every single one of them. One of the things that's happening, so I've been here at the Buck for 6 years, and one of the transitions I'm trying to make happen at the Buck is to transform it from a basic research institute on the biology of aging, which we've been for the last 20 years. We opened our doors in 1999, into a true biomedical research institute. That means really not only studying aging for the sake of studying, and that's, by the way, that's already enough, but I think we are at a really key transition phase in the aging space, where many of our discoveries can now be translated in humans. And so much of our growth now and in the future is going to be focused on really bringing the translation, taking basic discoveries, bringing them to the clinic. So that's my first hat. The second hat is I'm a scientist by training, and I still run a pretty big lab. So I'm one of the faculties at the Buck. I have about 25 people in the lab working on, again, different aspects of aging, and we can expand on this later. It's still primarily focused on NAD metabolism, ketone bodies, which lie at the interface between epigenetics and metabolic regulation. But we've also recently ventured into human immunology of aging, and including the generation and the study of new clocks, these epigenetic clocks that we use to measure aging. So this would be my second hat. The third hat is I'm involved in a number of startups as a founder that are focused on NAD metabolism. That's a company called Napa Therapeutics, or on ketone bodies. This is a project that we are conducting in collaboration with the Juvenescence Group. And it's focused on generating ketone precursors. So these are products that you can actually drink, and that almost instantly, within half an hour, generate a profound state of ketosis. And so we are exploring this from 2 different perspectives. One is as a supplement that you can buy, and it's actually available on Amazon already. But also another startup is involved in using these ketone esters for therapeutic purpose, that is conducting clinical trials in which we think these ketone bodies are going to be therapeutically helpful. And then finally, my last job is I do consult with a number of companies in the space. And the vision again here is to really carefully pick companies that I think are going to be major players in the aging field. And again, it's part of the whole translation agenda. Many of these companies are actually sitting at the front and really trying to either do clinical trials or develop novel supplements or develop novel ways of practicing medicine. And so the companies that I'm involved with, and we can discuss them probably in your next question, are all, I think, pioneers in different manners in this field. And I'm excited by that work as well. So these would be the 4 different categories that occupy most of my time.
Yeah, well, I have so many things to follow up on there that I don't even know where to start. So here's where I'll say to start. You do consult with companies in this space. You're also on a bunch of scientific advisory boards. One of them being the Alliance for Longevity Initiative. So I appreciate that you see us as an organization that's going to help with this translational issue from the basic biology to actual interventions in humans, because that's a lot of the work that we're doing, right? So I'm telling you that you just shouted us out, and I'm telling everybody else, guys, Eric Verdin just shouted us out, so we go us. But But so the second thing I want to say is, and I'm sure our audience would be interested in this. What's the name of that pill that's it's not a drink, it's a pill that's available right now, but
it's a drink actually. It's
okay.
It's got I don't want to be sort of crass in advertising this. It's called Metabolic Switch. It's a first, and if I can qualify it, it's a first generation product. It induces a profound state of ketosis if you take it. Mm-hmm. But unfortunately, it's not selling the way we had hoped, and I think one of the major reasons is the taste. And so this is it does not taste good, and it takes a while to get used to it. Once you get used to it, I think we have a number of people who take it regularly, and if you want to be in ketosis without being on a ketogenic diet, it works remarkably well.
Right, right.
The good news is we're working on the next generation, which actually I just tasted a prototype, and the taste is gone, which is remarkable. So,
all right.
If you've tried it and you've decided that this is not something you want to be on, keep watching for us. I think we'll be coming up with something in the near future.
Absolutely, that's awesome. Yeah, I was gonna say, like, you could add it with some put it in like a shake or something, but I think that would disqualify you from being in ketosis.
No,
so.
no, you can do it, and I think it's pretty interesting because all of us have experimented with it to try to get rid of the taste, and there are really unique things that do help mitigate this taste problem, and one of them is anything acidic like a kombucha will really get rid of the taste. So I know myself and other colleagues are taking it and just washing it off with a mouthful of kombucha. It does work.
Hey, that's definitely worth it for increased longevity. So a slight taste in your mouth that you don't enjoy, and then kombucha sounds like not too bad of a proposition to me. So I want to follow up also specifically. There's a bunch of other things to follow up on that the thread you just went on there, but I specifically want to talk about biomarkers and clocks, because I was at ARDD in Copenhagen back in August, and I was at the Longevity Dublin conference in Dublin, the Longevity Summit in Dublin. I've been to a few others, and it seems to me that everybody's talking about biomarkers, especially at ARD. That was I would say probably like half of the talks were about biomarkers and creating better clocks, and combining clocks to actually create a true biological age that actually is indicative of your overall health, right, and your overall well-being, more so than we have today. So let me ask you, aging as a disease, right? This might be a bit of a loaded question, but where do you stand on it? Do you want the FDA to make that decision? In my mind, we need better clocks before the FDA can even come to consider something like that. So what's your thought? What are your thoughts on aging as a disease, being kind of written in policy in the FDA somehow? Do you think it's a good thing or not? But also, can you tell the audience the importance of these clocks in terms of clinical trials, and why there's so much emphasis on these clocks being developed?
Yeah, so it is a loaded question, but I'll try to answer in the best way possible. I do not like the concept of aging as a disease.
Okay.
And the simple reason, for two reasons. One is the fact that it's sort of a in-your-face type of approach with regards to the FDA and with regards to medicine. And it's the type of a highly divisive question that will polarize people, against some people, against what we are doing. Now, it doesn't mean that, deep inside, we might not think, well, the aging process itself leads to disease. Okay, it's like high blood pressure by itself is not a disease, but it leads to stroke, and it leads to all kinds of problems in the long term. So we know aging is the biggest risk factor for all of the chronic diseases of aging. So the idea of going to fight the FDA for recognizing aging as a disease, for which we conduct pure clinical trials, in some way has been already won partially by Neil Barzilai and his colleagues, with the idea that the FDA has approved the clinical trial, a 10 clinical trial to proceed. That is the idea of giving metformin for prevention of some of the chronic disease of aging. So in some way, there are a lot of people who are discussing, pushing this agenda of aging as a disease and so on. We have to recognize that we live in an environment which is medicine, which is ruled by people who are conservative
Yep.
and benefiting from an existing system. So
Yep.
there is a better way, in my opinion, which is to do it the way most companies are doing it right now, which is to target initially one aging-associated disease and demonstrate the proof of efficacy and of your medicine. And I'll give you the example is Unity, for example, Unity Biotechnology, which was actually launched out of the Buck Institute in collaboration with Mayo Clinic. That company is now conducting clinical trials with senolytics, these drugs that kill senescent cells. And they're making very significant progress. It just released this past summer the first clinical trials that actually worked in the eye for some forms of eye disease associated with aging. And so one can imagine, that this drug could then be used for other complications associated with aging. So I think what the fastest way to move is not a sort of a head-on collision with regulatory and medical authorities, in my opinion. The best way is to work within the existing system and develop new drugs that in the long term might become recognized as protective against aging. And
Sure.
I could see a time, think about metformin. If the clinical trial is conducted and it works, metformin will be the first drug that slows down the aging process.
Right.
Now, this doesn't mean that we cannot try to conduct new clinical trials that are totally different, where, for example, we would only use a biomarker of aging. For example, I'm thinking about rapamycin. I think this is one that really calls for a large-scale clinical trial. And you could imagine that the readout could be, all of the markers that we have that actually assess the state of aging. So I can see we are right in a transition phase where most people who work in the system have to actually draw money from VCs, from investors. We have an existing clinical trial infrastructure. So this is the way most people are going. Of course, a number of people are pushing on the fringe and saying, well, let's make aging a disease.
Right.
Fine. I don't think this is that important right now, frankly.
Right.
It should be revisited 10 to 20 years from now when we have a first victory, because I always argue to the fact that, we have an incredibly ambitious agenda. Some, more ambitious than others, but we don't have a single victory yet. And I think the field is in need of establishing itself by demonstrating the validity of what we do and getting a victory. I predict that we will get our first victory in the next 5 years.
I agree.
Maybe it will be the TAME trial, maybe it will be Unity, or maybe it will be another, of the myriads of new companies that are on the horizon. Let's do this first and then establish ourselves a serious player in the field. And then, eventually I think we will be getting to where we want to go ultimately, which is the eradication of most of these diseases.
Completely agree. If I could have written a script for you to, and by the way, the audience said that this is not what happened, but I could have written a script for you to say, it would have been exactly that. You and I'm glad that my thoughts are the same as yours on this, Eric, because what I'll say from my position, being, the kind of the political lobbyist for the community, I get a lot of people who come up to me and, sort of demand that I make aging a disease a focus of what we do. But, I don't think people understand that, just from also just our perspective as an organization, that's quite a big demand to, like you said, there's a lot of incentive for the, the FDA and the current medical system. They don't really have much of an incentive to make a massive overhaul and change, right? So,
Exactly.
That's a big ask. That's a big ask coming in and making aging as declaring aging as a disease, especially like you said, when we don't even have a victory, right? And societally, right, I don't think people are going to ever really accept aging as a disease until there is a commercial on TV for a drug, for one of these companies, saying, hey, take us for aging, right? So, I think there actually needs to be a drug out there before we can, start seriously making that ask. And a lot of these companies that I'm sure you're involved with many of them. I see a lot of them doing, and a lot of them come and support what I'm doing because of the work we're trying to do with the FDA. I see them operating perfectly fine in the environment that exists right now, right? So I think a lot can get done. I share your optimism. The next 5 years, I think some really awesome stuff could happen. There's so much in the pipeline. I mean, there are hundreds of drugs in the pipeline. Phase 2, completing phase 1. Finishing up their. It's getting kind of crazy out there. So I'm glad that we're kind of on the same wavelength there. I'm glad to hear that. So let me ask you then, what do you if you had to choose one, a proverbial gun to your head, somebody says, hey, Eric, you need to pick one longevity therapy that you like the most, what would it be?
Oh, this is a really tough one. You're asking me to choose between my children. I mean, it's, no parents can do this. I can highlight a few that are.
All right. That's fine.
Okay. If you think about the longevity space, it has a really unique mixture of sort of your traditional pharma companies or biotech companies. And, of course, Unity is a favorite because it emerged, it's the leader of the whole senolytic field. It emerged out of the buck from Judy Campisi's work. So we're quite proud of what they're doing. And we think they're likely to be the first one to score a true victory. But there are other companies in the space. Deciduous is another one in San Francisco that really is pursuing senescence from another point of view, which I think is equally exciting. So I can give you some other names also. BioAge with Kristen Fortney is a great company has shown remarkable growth, has interesting target. They're also taking the approach that I highlighted earlier to go after specific disease. But other companies, Rejuvenate Bio in Belgium, GenFlow, but there's also so these are like your more traditional biotech companies. There are also a number of companies that are making noise, which are, I would describe more as supplement companies. So these are companies that have identified novel supplements, but they are pushing them using clinical trials. There are a lot of companies right now that sell all kinds of products that you can take or not, and there's always an implicit hope that they will actually be beneficial. And I want to highlight a couple of companies that are doing supplements, but doing it in a way that I think will bring true answers. Because the bottom line is, you can spend $70 a month taking something with the hope that it might work. For me as a physician, this is not enough. We have to prove the efficacy of what we sell, and we don't want our field to become sort of a field of snake oil and charlatan. And I think so. A company that comes to mind is Senec. This is actually a French Swiss company that sells an NMN, sort of precursor to NAD, and they're conducting rigorous clinical trial. Another company I'm thinking about is Amazantis. This is a Swiss company that sells a product called Urolithin A, which is a product that's generated from pomegranate by your microbiome, and has really amazing effect on mitophagy and mitochondrial function. And they're, again, also conducting rigorous clinical trials and demonstrating the efficacy of what they're doing. So those are exciting. And on top of these supplement companies, there are other companies that are exploring completely novel sort of approaches to longevity. One that I'm associated with that I found exciting is called Lifespan, LYFSPN.
Yep.
And that's a company led by Dobry Kiprov and Yuri Greenwald that is really looking at plasmapheresis. And so this came out of data showing that from, and I'm blanking on the name now, but Irina Conboy and her husband showing that plasma dilution actually leads to an increase in longevity and protection, increase of health span. So this was these are studies that emerge out of the heterochronic parabiosis studies, where you hook up a young and an old mice together with one single vascular system, and you find the young mouse actually gets older and the old mouse gets younger. So this led to the idea that there might be factors in the young mouse that would have rejuvenating effects. But what the convoys found is that it seems to be that it's more diluting the age-associated factors. That's the major driver in these experiments. And so the idea of doing plasmapheresis in humans is really exciting. And so this company is now set up and will be doing its first clinical trials, which are, by the way, truly placebo-controlled, which is, I think, a first in the field of plasmapheresis, to really make sure that what are the beneficial effects, what are the markers that you can identify, and so on. And another company that's also pursuing this type of intervention is Aviv. That's an Israeli company that is pushing for HBOT, hyperbaric oxygen therapy. And the idea there is to place people, during a few weeks in these hyperbaric oxygen chambers, and they have, again, here also incredible preliminary results, and are in the process of setting up clinical trials that will really assess the efficacy of this treatment. So that these would be, a whole series of inventions. And, the bottom line for me in this field is that it's so early, and there are so many incredible opportunities that I embrace them all. Let's just test and go through rigorous testing and demonstrate their efficacy or not, and then move on. And
absolutely.
So there's a whole other.
You just
go ahead.
You just named like 5 different areas, and I'm sure you could probably name more that you're excited about. Like, I share that sentiment. We need as many. It is so early. We need as many shots on goal as possible. The plasmapheresis stuff. It's the parabiosis stuff always freaks me out, because I don't want to be the I go to these longevity events as the younger person. I don't want to be the young mouse, if you catch what I'm saying.
You don't want to be the blood boy. Did you see Silicon Valley?
Yeah, exactly. The joke's on them. I've been eating Whoppers for the last 2 years, so so they don't want my blood, but that's a joke. But so I want to pivot a little bit and kind of discuss something that you've been mentioning in the last 5 minutes pretty extensively. You've been mentioning companies outside of the U.S., right? So you're from Belgium. And I don't know much about the longevity space in Belgium, but I believe you just said Rejuvenate Bio is in Belgium.
Yeah.
You mentioned those few Swiss companies. You mentioned the company from Israel. So, can you kind of tell our audience a little bit about the longevity scene? Obviously, not just in, not just specific to companies, but in terms of the wider scene. Where do you see most of the activity happening? Is it in Europe? Is it in America? I mean, I would assume it's in America because most of the companies reside over here. But where is the next big wave of longevity research coming from? There's obviously the Evolution Foundation. There's things that, there's the population crisis that's impending in pretty much all Asian countries, right? So they're soon to get involved. Where do you see the next big hub of longevity medicine? And if it's the U.S., that's also an answer too. I mean, I think the U.S. is still in a very strong position to kind of lead the world in this space. But what are your thoughts?
I agree. I think the short answer is that it's become global. But if you look historically, a lot of the basic research on aging emerged out of the Boston area and the San Francisco Bay Area. Right now, it is still very much focused, I would say, mostly in the Bay Area, and both in terms of academics and in terms of biotech companies, so that we probably have the largest concentration. I started a good example of this is I started about 15 years ago with Danica Chen, who's a professor at Berkeley, a working group, which we call the Bay Area Aging Meeting. And so the idea was to
Mhm.
bring academicians, or biotech people from the Bay Area studying aging. Our first meeting had 60 people, and we hold these meetings now 3 times a year. We rotate between Stanford, the Buck, UCSF, and Berkeley.
Mhm.
And every one of our meetings has close to or more than 600 people, which is pretty remarkable. When I look at this, and I just realize, this field has just grown, and right now we're at full capacity. We can't get any bigger than this, and so that just gives you a representation of what's happening in the field. To have 600 people 3 times a year getting together to talk about science in one single area is pretty remarkable. But
Yeah.
obviously, we're the early ones, but we're not the only ones.
Mhm.
Now, global research on aging has really become a global process. There are some countries which have a bigger footprint, and probably would be Germany and England right now.
Mhm. Mhm.
But that's also historically for much of biology. Again,
Right.
that doesn't mean that there are no research programs in Belgium or France or other countries, but clearly Germany and England are leading the way in Europe. And in terms of biotech, I think we've seen this really becoming global as well. The Middle East right now is growing very quickly. There are, large foundations that are coming into the field.
Yep. Yep.
So, Switzerland, Germany, everywhere. I think that's the exciting part of the field right now. We've talked about this hockey stick type of inflection point that would happen in the field. We talked about it for many years, and it's in the last 2 or 3 years, it's finally happening. We've seen
Mhm.
an incredibly rapid growth of funding and interest and discoveries, frankly.
Absolutely, yeah, and like you said, that there's a lot of philanthropic action, right? But what my thought process is, and the reason why I started A4LI is because the U.S. government has the largest purse in the entire world, bigger than any company, bigger than any country, bigger than any entity that's ever existed ever, right? And I'm sure the numbers, but only the NIA division of aging biology gets what, $300-400 million a year. I don't know what the number is going to be this next upcoming year, but if you compare it to, you say, the Evolution Foundation with Saudi Arabia, if we want to have the same proportionality with them, if we account for GDP and sizes of our country, we should be investing billions and billions of government dollars into this space, right? So
Yes.
and that's one of our biggest goals, right, at A4LI, is to continue to unlock government funds for the space through different programs, whether it's the NIH, whether it's the NIA, whether it's ARPA-H, whether it's NSF, whatever it may be. That's part of our goal, right? And so one of the things we want to see happen, and I'm actually very happy that so I haven't gotten to tell you, and I guess I'll tell our audience, we're going to get this caucus together by the new Congress, and we're working to find our 4th and final Republican co-chair. So anybody listening, it's very, very exciting. It's working out in a very nice way, and we'll make the announcement with who is involved. But some really high-profile politicians are going to be.
This is fantastic.
It's very good.
Congratulations. I think it's going to be a really important aspect of everything that we try to do.
I hope so too, because doing work with the FDA and getting funds from the government is a lot easier when you have an interest group within the government, right? So we'll be making that announcement soon. That's not the point of this, but what I'm excited about is we got this done early. I was expecting to get this done by like September of 2023, and the fact that we're getting this done closer to November, December of 2022 means that we get 2 shots at increasing appropriations to the NIH, NIA, right? The appropriation season is February to March, February to April-ish. April's a little late, but now since we have this caucus together, we can make 2 formal asks with the caucus, which is very, very exciting. So I just wanted to get that all out on the table. Very exciting news. But here's my question for you, Eric. So let's say, I don't know what the budget exactly looks like at the Buck, but let's say the amount of government funds that you guys receive just doubled overnight. What do you think that would allow you to actually do? Like, what would you accomplish? Would you need time to figure it out, or do you have like immediate needs for funding? Like, how dire not just for you guys, just in general, I would say for the field, how dire are an influx of funding?
Well, there are many ways to look at this. One way to say it is that the field right now is not short of ideas. We're short of funding. And so, if there was all of a sudden more funding, there are so many more things that we could do that we cannot do right now. A second aspect is the fact that right now, because the funding is so tight from the NIA in terms of basic research on aging, we spend, all of us, an inordinate amount of time writing applications, and being denied funding. Right now, the funding is around 10 to 15%. So if you write a grant application, you have 1 in 10, 1 in 15 chances of seeing it funded. That means you have to go back, and I've always argued that there are no reviewers that can really reproducibly distinguish an application that is in the top 10 versus the top 20. So if you look at the second tier, from 10 to 20, these are top applications. They should be funded immediately.
Right.
Instead, it takes 6 months to find out that your application is not funded, and then you have to go back and reapply. And in the meantime, the work is not getting done. So I think we have an incredible amount of potential targets and directions to expand on that are not being done. And I've always argued that, if you think about aging as the major risk factor for all of the non-communicable diseases, the chronic disease of aging, there should be so much more spent in terms of part of our budget from the NIH focusing on these core mechanisms, because they will affect all of the diseases. Instead, we have a system which is still organized in silos, where we have a National Heart, Blood, and Lung Institute, and we have an Institute for Cancer. We have institutes that are focusing on individual diseases, and we don't pay enough attention to the core, which is aging. So I think, there's a need for more funding. If there was more funding at the back, we would expand. We're ready to expand our efforts. And right now, because of the length and the heaviness of the grant writing process, more and more of our work is being funded by philanthropic organizations. And so that allows us, write an application, within a month it's reviewed, a month after we get the fund, and we go on. And a larger and larger fraction of our budget is actually coming from these types of sources. And I think, I also like the NIH because it's an extremely rigorous organization in terms of when you get a grant from the NIH, you have jumped through so many hoops in terms of the validity of your work and the seriousness. So for us, getting a large fraction, about 50% of our budget comes from the NIH, is an external validation of the quality of our science. And so I would not want to change this, but I think for your listeners out there, they should know that there are so many other things that could be conducted. For example, I've been interested in conducting a clinical trial for rapamycin in humans. And we haven't, this experiment cries to be conducted. Everyone knows rapamycin is the most powerful drug that we have today to slow down the aging process and to increase lifespan and health span in animal models. And we've known this for a number of years. Actually, some of the early discoveries were made here at the Buck. But the fact that we still have not conducted a human clinical trial, for me, is hard to understand. So again, I probably would never go to the NIH asking for this because I think it was unlikely to be funded, but donors might be interested in this type of work. And so there's an incredible need for people who are passionate about our field to come and help us to realize all of its potential.
Yeah, I mean, 50% of NIH funds. That is quite impressive. I didn't realize that. But yeah, there are so many. I hear this all the time when I try to bring sponsors onto the A4LI into the A4LI world, right? And there are all these biotechs, these small biotechs, trying to write grants to even get their project off the ground. and they can't because they have to write 50 grants, and with the hopes that one of them even gets accepted, right? And the process for review to acceptance or rejection is too long. But also, like you said, that second tier probably is. I don't know. I mean, I'm not a grant reviewer. I'm not I'm not a reviewer of these things. But I would argue the top 50 might be even worth looking at. Like, why not, right? I mean, the more shots on goal, like I said before. I mean, that's my hypothesis. The more shots on goal, the better. But I think America and the American government, the NIH, we take pride in the fact that we only kind of fund the most the best science, right? So
Yes.
I don't necessarily know if we need to change it, but maybe a little more expansion on the amount of grants, and maybe shorten the amount of time that it takes for people to find out would be a great thing. But okay, well, we're going to continue to push for more money, also, just because those, like I was about to mention, there are those biotechs out there. There are those people who are trying to get, I saw recently someone from UC Berkeley using a GoFundMe to start his longevity biotech. Like there's no reason that he should have to do that. If he has a legitimate idea, or I shouldn't say he or she has a legitimate idea, you just go, the government should be wanting to fund these new exciting initiatives, right? So I think that's an interesting point. And I think, like I mentioned, we do have a shot to actually get that done. Twice. We have two chances now instead of what I originally thought. Just we had one. So we're almost out of time here, Eric. So I want to wrap up with two more questions. I want to wrap up with two more questions. The first question is, and this is something you might not have too strong of an opinion on, but maybe you do. We saw, I'm sure you've seen the crypto space get very involved with longevity over the last year and a half, probably since the 2021 started, I would say. I'm still kind of figuring out why. I guess they kind of go hand in hand in that they're both futuristic kind of fields, but I never really fully understood why. But I appreciate the crypto community getting involved. But so I guess my question is, since you're in the tech capital of the world, like what other big tech areas are moving to longevity like crypto did? Like it would make sense to me that like space would be a natural ally with the longevity community. Do you have other kind of spaces that you see getting very involved with philanthropic efforts like crypto did?
Well, so there's been a little bit of a perception that which is actually harmful for our field, that our field is sort of funded by the rich for the rich.
Mm-hmm. Sure.
And this, some of the perception for this was that many of the biggest players in Silicon Valley have actually contributed to aging research. Jeff Bezos has been involved,
mm-hmm.
in it. Sergey Brin and Nicole Shanahan, the Chan Zuckerberg, all of this contributing to aging research has contributed to the idea that maybe these are people who are billionaires and they want to live forever. And
mm-hmm.
and I think there's nothing wrong with this. I think what it just reflects is the fact that these are the people who are in our neighborhood. And what they're doing in terms of supporting aging research is they've identified as one of the key areas of growth of biology in the next 20 to 50 years. And they're doing the same thing that the Rockefellers and Carnegies were doing back in 1900.
Absolutely.
They were supporting, Rockefeller University and making huge discoveries at the time in infectious diseases and
mm-hmm.
immunology and so on. So there's really nothing unique about this. One thing that, and again, the crypto group is the same. I've met with a whole group of crypto young investors recently at a meeting that was jointly organized so that we would interact between aging scientists in aging and crypto investors. And one of the things that really struck me is the shift that one of the important things that we're trying to do is really change medicine.
Yep.
Or to add on to medicine and make medicine much more preventative. Medicine should be something that starts when you're 30, which is the time when we think you start aging, and you should be monitored, and you should be evaluated, and your lifestyle and interventions should be conducted throughout life. And a typical signal that this message is actually being received is the fact that younger and younger people are interested in their health and their well-being, because they realize, the investment that you make when you're 20, 30, 40 will carry, throughout the rest of your life. And so to me, that's incredibly exciting. The combination of the people who have the money and who discover, I always say, wealth without health is worthless.
Absolutely.
If you're going to be wealthy and be able to enjoy it with a long, healthy life, this is really incredibly important. And so, the people who do this, do it, support us from the crypto world, from the tech world, do it out of passion, out of self-interest, and out of the vision that aging has become a tractable problem. And so these are people who are used to solving problems very quickly. It takes some education on our side to tell them how, the clocks are ticking more slowly in biology than they do in technology. It's just harder. But the importance of the mission is absolutely amazing. And it really sort of invigorates us to think that we have a whole young generation of people sort of backing us up and trying to help us accelerate our mission.
Absolutely. Yeah. There's a ton of young talent, that I've seen it, people, just in their 20s, 30s, 40s, a lot of like younger people jumping from different fields into this space to get involved because they're so excited about it. That is really exciting. I'm with you on that. And I also wanted to just say, just to add on to one point that you said, there is this perception kind of that, I'm not kind of, there is the perception that longevity and aging therapeutics are, being made by the rich for the rich. Right. And, that's also kind of one of the, reasons why I wanted to get the government involved, because, the government is taxpayer money needs to be going to this. The government needs to, have some sort of, not hand on the lever, but, work with the private, investors and, rich folk and philanthropists, moving this field forward. The government needs to be working hand in hand with them. And, in that way, we'll ensure that these drugs and therapies become affordable for all, right? Because at the end of the day, I don't think any longevity scientist or investor or entrepreneur or any longevity advocate wants this to be just for billionaires or for the rich, right? I think everybody wants to see the entirety of human civilization become healthier, and so that's kind of my vision. That's why that's the pitch I make to the government, to policymakers all the time. This is as much of it, this is, there are roadblocks and barriers in the government that need to be removed to help this field flourish, but also from a public perception standpoint, the government needs to be involved to show that this is for everybody, right? The government is supposed to represent everybody, and if they're involved, it shows that this is for everybody, right? So I agree with you, everything you said there too. I'm glad everything. Nobody can see my head nodding up and down, but I might have to put an ice pack on my neck after this, because I've been agreeing with you so hard, Eric. So that's good on my end, because at least I'm a sane actor in that respect. So Eric, we have the last 2 minutes here. So I want to just kind of, what I like to do to end off these interviews is ask our guest to say something that gives our audience hope for the future. Why should we be optimistic, about the world in 10 to 20, 30 plus years? What's your outlook on humanity? And if you're not optimistic, how can we get you optimistic? What would you like to see happen in the world?
It's a wonderful question. It's one that's actually really easy for me to answer. I am an optimist. I'm sometimes being faulted for being too optimistic. But that's just the way I'm built. So I'm not planning to change this. One thing I would like your audience to know is that the 20th century, when you look back, was the century of physics. If you think about what happened in the 20s and 30s with Einstein, and the laws of physics were being deciphered, and this led to within a short order in the 1950s to the first transistor, and eventually computer chips and so on. And think about what happened from 50 years of basic discoveries, the first half of the 20th century, and then we are now 70 years later, 2020, all walking around with a supercomputer in our pockets. And this phone revolution has just been nothing short of outstanding. When I was a kid, we used to talk about the fact that one day we would be able to see each other talking on the telephone, and that just sounded totally science fiction. But now, not only this, but we do it in our pockets, and we have, just think about Wikipedia, think about everything we have with this telephone. It's absolutely amazing. Now, the 21st century that we're living in now will be known as the century of biology, just like last century was the century of physics. And what we are doing right now is very parallel. We're laying out the basis of a global understanding of the aging process and its ability to influence disease. And now, I love to make predictions, but they're extremely hard to make. And I think no one in the 1920s was able to project and predict what would happen 100 years later. And so I will abstain from any prediction, but it's hard for me not to be excited about what lies ahead for us in terms of health. If you think about the science of aging, it has undergone a revolution in the last 25 years. We now know that aging is a biological problem that can be studied, with the modern tools of molecular biology and genetics, and this will lead to incredible new discoveries. Now, I don't think this will ever lead to immortality, and I frankly don't like the fact that some people in our field are using that term, because that puts us in another realm, which is the one of religion. That nothing wrong with this, but I think that there's in my opinion, no need to talk about outlandish claims such as immortality. But beyond this, I think no one knows what's going to happen, except incredible potential that we are studying one of the core mechanisms that leads to disease. And I've said, if we already were able to realize for everyone to live to 95 in good health, think about what we have right now. Most people live to 65 in good health. The next 30 years of quality life would already be amazing. And this, I think, is reachable today. So to me, that's already one thing we're working on very actively. What the future will bring us, I think it will be amazing, but I won't be able to tell you exactly what it's going to look like.
Sure. Well, I share your optimism, and I think there needs to be more optimism about the future. I think a lot of people are worried about what the world's going to look like if it's, we do focus groups all the time, and some people say, is the world going to be worth living in 50, 100, 150, whatever, how many years we talk about. And so, I say yes, because, I'm sitting here in an air conditioned room, with a Whole Foods drink outside, and you're sitting in your, office in an air-conditioned room. Then, 100 years ago, we would be, sweating and in huts and not happy, right? Or not huts, but, relative huts to what we have now. And, the 100 years before that, it was much worse, right? So you have to, you have to look at things in kind of large historical data sets, right? And kind of see, how much, like you said, like it's actually quite nice. The way we started, the way we started this podcast is we looked back on your beginnings and longevity. And, it's always good to reflect on, the beginnings, not just of an individual's career, but also humanity, right? Where we were hundreds of years ago to where we have gotten today, gives me optimism, gives me hope, and it makes me optimistic. for the future. So Eric, again, finally, every question, I'm definitely putting a nice pack on my neck. We're on the same wavelength 100%, and I'm glad to hear that. I think you're probably out of time here now, so I'm going to let you run. Is there anything you'd like to say to our A4LI audience before you go?
No, just want to congratulate you and your colleagues for putting this organization together. I think this, I believe you will play an important role in our mission, and I will issue this as a public invitation to any of your listeners who are interested in visiting the BUC and learning more about what we're doing to come and visit. And I look forward to our future interactions. And thank you for the opportunity to speak today. This was great.
Thank you. I'm going to take you up on that offer, Eric, sometime soon. All right, sometime very soon. Absolutely. All right, cool. All right. Well, Eric, good talking to you. And thank you for everybody listening. Please, stay tuned for our next installation of the A4LI podcast series. Thank you all for listening.